Welcome back. The National Commission for Persons with Disabilities, in partnership with Christian Blind Mission and other stakeholders, are calling for stronger enforcement of the National Disability Act to ensure persons with disabilities have equal access to basic services and opportunities. The call was made at a biannual review meeting in Abuja on the implementation of the National Disability Act, organized under the Disability Rights Advocacy Project for Inclusive Development. As they say, gaps in enforcement, accessibility and awareness continue to hinder inclusion. They are calling on government and relevant institutions to strengthen implementation, improve accessibility and ensure accountability, stressing that disability rights must translate from legislation into meaningful action.
There are still gaps with implementing these laws, disability laws at state and national level. There are still gaps with capacity of these new disability agencies. If you don't know how many we are as people with disabilities or where we are, there's no way the impacts can reach these people. A lot of the disability agencies are still adopting the charity approach.
We talk about challenges in education, challenges in transportation, challenges even in accessing healthcare services, challenges in accessing even capital to establish as a person with disability. Some of these barriers should be removed so that we can actually be able to operate like every other person.
A few months back, the Nigerian Bar Association adopted the disability inclusion policy. That's the first of its kind, at least in Nigeria. So yes, that policy has been passed and approved by the National Executive Council of the Nigerian Bar Association, and that's a very huge landmark for the forum.
This project is a platform to create awareness, strengthen the government organization at national and then state level, including supporting organization of persons with disability at the community level, for government to put up a good mechanism for implementation and enforcement of the disability law.
The Federal Executive Council has approved an amendment to Nigeria's Mental Health Act aimed at decriminalizing attempted suicide. The proposed reform will shift the response from punishments to medical care, psychological support and rehabilitation for people experiencing mental health crisis. The amendment will now be transmitted to the National Assembly for consideration, marking a significant shift towards a more compassionate mental health response.
FEG approved the amendment of the National Mental Health Act to allow for the decriminalization of attempted suicide in Nigeria. As you all know, suicide is a major public health concern in Nigeria as well as several other countries. According to the World Health Organization, it is responsible for more than 7,000 deaths annually, with an estimated 300,000 suicide attempts across the country each year. The impact extends beyond the individuals involved. It affects families, friends, and communities, with over 450,000 Nigerians requiring psychosocial support annually. And globally, suicide is the third highest leading cause of death among young people.
Joining us virtually is Dr. Olajumoke Koyejo, a psychiatrist, Federal Neuropsychiatric Hospital, Yaba, Lagos. Thank you so much for joining us, ma'am. How are you receiving this new update regarding the decriminalization of attempted suicide?
Hello?
Olajumoke, can you hear me?
Okay, faintly, I said earlier.
Okay, so I was just asking, how have you received this update regarding the decriminalization of attempted suicide?
Thank you very much. Before now, attempting suicide, which is, of course, can be subsequent due to an illness, was a criminal offense. But today we are so happy, and this is an historic judgment, decision, policy by the federal government. You can imagine someone that's going through severe depression and getting to the level of suicide and now making an attempt, and he's actually survived this attempt and you're actually making this a criminal offense, the person should be treated.
Okay.
However, others that have hypertension, that are diabetic, they're not sent to prison, or there's no offense for being sick. So this judgment is a huge step in the right direction. I want to commend the federal government for this policy. Thank you.
So specifically, what are you looking out for? How do you think that we would, basically move on from now? What do you intend to see when this particular decriminalization comes out?
Yeah, thank you very much. Well, for anybody that has attempted suicide, of course, for me, it's a psychiatric emergency. And those people, whether you have money or not, should be treated. There's need for psychosocial support. There's need for treatment. And I would even expect that for such persons at the verge of committing suicide, treatment should be made free for them, because they're actually giving up on life. And they need expert care, and that should be given to them whether they have money or not. Because life, once it's taken, you can't restore it back. That's my stand. That are things I expect the federal government, not just decriminalize it, but people that history or with attempted suicide should actually receive free treatment at that acute stage of care.
What specifically do you feel, as someone who has actually worked in that environment for quite a while, what specifically do you feel are what causes people to attempt suicide?
I didn't hear you. I didn't hear you well.
What do you think make people commit suicide?
What are the causes? Is that what you said?
Absolutely. What causes people to commit suicide?
Thank you very much. Well, there are several causes of things that could cause suicide. Several psychiatric diagnoses could cause suicide, apart from socioeconomic factors and things like severe depression. A patient that has psychotic illness could want to commit suicide. Even someone that's coming out from addiction would want to commit suicide. So there are several reasons why our patients would want to commit suicide. And so there's really need for in fact, prevention is the way to go. Because when you see such patients, they would have been going through some form of challenges along the line. And for them to get to that level, that means it's like the end of the spectrum. So why allow them even get to that end of the spectrum? Why not attend to them on time? And so I would expect free mental health care for patients, or subsidized care for patients with mental health issues.
All right. Many thanks, Dr. Olajumoke Koyejo, psychiatrist, Federal Neuropsychiatric Hospital, Yaba, Lagos. Many thanks for your time. We truly appreciate.
Thank you very much.